2010, in West Bridgewater, Massachusetts, Steve Wolin laid in his front lawn, unconscious, blue, and barely breathing. His mother, Linda, spotted her son and frantically ran outside while assembling a pen-light canister. With her heart pounding, she dropped to her knees and used this device to administer medication into her son's nostrils. Within minutes, his color restored, his eyes opened, and life returned to his body. Steve had overdosed from heroin. With opiate overdoses being one of the leading causes of death in Massachusetts, the Department of Public Health launched the Overdose Education and Naloxone Distribution Prevention Program, also known as OEND. First, I would like to discuss and provide information about opiates and naloxone. I would also like to inform you of the OEND program, and finally talk about how OEND can save lives. The information I will be providing comes directly from the Mass Department of Public Health, which I will refer to as the DPH, and the Boston Public Health Commission. Naloxone is also known by its brand name Narcan. It's a medication used to reverse an opiate overdose. Opiates are depressants that slow down the central nervous system and at high levels reduce consciousness and cause respiratory depression. According to the Mass DPH, opiates induce a sense of euphoria and relieve stress and discomfort by creating a relaxed detachment from pain. Opiates can be found in illegal street drugs as well as in legal prescription medications, but the effects are equally as risky. Some common examples of opiates include heroin, methadone, oxycontin, Percocets, morphine, fentanyl, and Vicodin. An overdose occurs when the body has more drugs in the system than it can handle. According to statistics provided by the Mass DPH, in 2013, there were a confirmed 908 fatal opiate-related overdoses in our state, but that number is estimated to rise to 1,023. Naloxone can save these lives. Naloxone is safe, easy to administer, has no potential for abuse, and no side effects. It's only effective to counteract opiate overdoses because it blocks the opiates and restores normal functioning. Hospital emergency rooms and paramedics have been safely administering naloxone for decades. In 2007, Massachusetts launched the OEND program. Let's take a closer look. The Mass DPH successfully launched the prevention program OEND. In cases of overdoses, it's highly likely that family members will be the first responders. According to Chapter 192 of the Acts of 2012, Massachusetts law states, and I quote, "A person acting in good faith may receive a naloxone prescription, possess and administer naloxone to an individual appearing to experience an opiate-related overdose," unquote. Getting naloxone into the hands of a responsible person who is likely to be a first responder will save the lives of people that otherwise might be lost waiting for an ambulance. In order to qualify to legally carry and administer naloxone, the OEND training program is a requirement. The Boston Public Health Commission and Learn to Cope offer these training sessions, which are open to any Mass resident and are available throughout the state on a daily basis. Participants learn about the importance of calling 911, how to prevent and recognize an overdose, how to administer rescue breathing, as well as how to administer intranasal naloxone. This is a photograph of the intranasal naloxone. After your training program is complete, you will receive a complete emergency kit with the nasal naloxone and further instructions. Additional naloxone can be picked up directly from participating pharmacies as a standing order has been issued by the medical director of the DPH. In an overdose, time can be the deciding factor between life or death. The Mass OEND program attempts to eliminate this time by giving residents necessary life-saving treatments. To review, opiates are one of the leading causes of deaths in Massachusetts. First, naloxone has the potential to reverse an opiate overdose within minutes. Secondly, OEND is a program that stands for Overdose Education and Naloxone Distribution. And lastly, by participating in an OEND training session, you can save lives. It doesn't matter how old you are, what you look like, your education, your income, or your zip code. Addiction does not discriminate. Participation and involvement in programs such as ON could save the life of your friend, your coworker, neighbor, relative, or God forbid, as in Linda Wohan's case, your child.